Very good morning to all. Welcome once again to this Medical Corner, a space where you and I meet every week to discuss medical issues together. I am Nadis Pino Bernal, and today we will be talking about one of the most important and most popular drugs worldwide since its use and distribution was approved at the end of the 20th century. British scientists were studying a new medication to treat angina pectoris, a cardiovascular disease that affected millions of people in the United Kingdom. However, the results obtained in that investigation were revealing. A problem that affected millions of men around the planet would find its end. In 1998 was that year where the FDA decided to approve the marketing of who today becomes the protagonist of our program. I am referring to sildenafil, also known as Viagra. Sildenafil Viagra is a drug that will be used for male erectile dysfunction. That is, we will prescribe it to those patients who cannot develop an erection or who, on the contrary, cannot maintain it to have a successful sexual relationship. They are the patients who will benefit from the use of this drug. And now you will ask me, but what does Viagra do? What does sildenafil do in a male patient's system? Well, to do this, first let's understand how an erection works, because only then will you be able to understand what sildenafil does in your body. Well, for the patient to have an erection, a series of factors must come together. The erection will not occur only due to an isolated factor, but all of them have to come together and all of them will help this process to take place. Now, who is the one who has a relationship with the drug? Well, a system called cyclic GMPPKG nitric oxide. All of these that I have mentioned are going to work as if they were in a chain. One will stimulate the other so that that other activates the subsequent one, so that if they do not act like this in chains, the erection will not take place from a biochemical point of view. Now, like all things in life, they have to be self-regulated. Because obviously the patient cannot have an erection forever. Because this would be a condition called priapism and it does produce permanent erectile dysfunction. So, in order to avoid this problem, the body has a way of self-regulating and inhibiting, stopping that erection when necessary. And the way the body does it is through a protein, an enzyme called phosphodiesterase. There are 11 families, phosphodiesterase families, but 5 is the one that will act here. At this level, what phosphodiesterase 5 is going to do is cut off this chain of events that I mentioned about nitric oxide. It is going to inhibit cyclic GMP. It is going to inhibit it. It is going to convert it into an inactive form so that it cannot activate package and therefore so that an erection does not occur. So now you are going to tell me, Concho, but how bad is this phosphodiesterase? Well, no, it's not bad. Thanks to it, you avoid this disease called priapism. So where does sildenafil play an important role here? Well, sildenafil is precisely going to inhibit that phosphodiesterase 5. It's going to tell you, you're not going to produce your action now. It's going to stay there calmly so that my entire nitric oxide system can produce an erection. And this is the mechanism by which it acts. Who would be the patients who can use sildenafil? The truth is, practically all men can use sildenafil. Don't be afraid of him. It is a very good drug if used responsibly. Now we are going to learn each group of patients step by step so that you can understand it well. And when it ends, when the program ends, you will be a professional on the subject. Let's see. Patients from 1 year to 17 years old will use it to treat pulmonary hypertension, because when these children take Viagra they benefit in terms of the ability they will develop to tolerate exercise. Now, probably all the patients watching this show are not this age, and they will tell me, well, and I can take it. Let's see, adult patients can take Viagra, yes, they can take it. And the recommended dose is 50 milligrams once a day. 1 hour before beginning sexual intercourse. After that, if everything was fine, we can make the decision to reduce the dose to 25, or if there was a problem, then we can increase the dose to 100 milligrams daily, which would be the maximum dose to take per day of this drug. Now they will tell me, well, and if I am a patient who has a kidney problem, let's say kidney failure, can I take it? The answer is yes. It is known that patients have mild or moderate renal failure. In other words, when they do a blood test called creatinine clearance, if you have values between 30 and 80 milliliters per minute, you will simply be given the same dose that we give to the rest of the adult patients. There will be no need to make any adjustments. Elderly people who are healthy, who do not have any cardiac or cardiovascular pathology. These elderly people can also take the medication in the usual doses of 50 milligrams 1 hour before. Patients who have liver failure because, let's say, they have drunk a lot of alcohol during their life and have liver cirrhosis, can also definitely take this drug. What happens is that in them we are going to start with a lower dose of 25 milligrams an hour before having sexual intercourse, and in the case of severe kidney failure, which is when this creatinine clearance test that I told you about is already below 30 milliliters per minute, then they would also start with 25 milligrams, and then if the sexual relationship was satisfactory, then perfect. That is the dose you should take. If it was not, then to increase the dose you will have to have an analysis done by the cardiologist, and you will also have to have other blood tests to determine if we can increase the dose to 50 or if the urologist will later increase it to 100. If there is something very important that you should know in relation to sildenafil, when you take sildenafil, it will go directly to bind to a series of plasma proteins, and they will fundamentally act on the maximum concentration of sildenafil. When you take it, it will be on time. That's why we say to take it an hour before you have sex. However, they will remain in the blood for up to 5 hours, which is their half-life. They will be present in your body. In the case of sildenafil, what happens? That he can't be inside your body all his life? And that, the way your body manages to eliminate it or metabolize it is through a system called cytochrome P450. This system will be a group of enzymes that will be responsible for metabolizing that sildenafil and finally making it possible for it to go to the liver, and subsequently, when it is metabolized, it will be eliminated by 80% in the feces and a small percentage by 100% by urine. What happens if this cytochrome P450 is responsible for regulating that sildenafil so that it does not cause adverse reactions and so that it is only in your body what it should and no more? If this P450 is decreased or is inhibited by some drug, then sildenafil will remain in the blood much longer and you may have some type of adverse reaction. That is why it is important that you always tell your doctor what medications you are taking. You have to write them all down on a piece of paper before going to the consultation and taking them to your doctor. Because some of the ones I am going to mention now do precisely this action. It inhibits my P450 and of course, it leaves you prone to developing any adverse reaction, because there is no way to metabolize sildenafil well. Who are these drugs? Look at ciprofloxacin, which we send very frequently to treat urinary infections, and cimetidine, which we send frequently in the case of gastritis. Others such as amiodarone, diltiazem, imatinib, ketoconazole tablets. Not the cream. 200 milligram tablet. Itraconazole. Cyclosporin. Erythromycin. In other words, there are many drugs that have this mechanism. Many times you have heard someone say that if you have hypertension you cannot take sildenafil. Actually, this is not true. Hypertensive patients can take sildenafil. What happens is that there are some hypertensive patients who take some medications, such as nitrates, which are vasodilators. That is, they open the arteries and veins and therefore blood pressure decreases. What's happening? When sildenafil is combined with these nitrates, the effect is greatly enhanced and then blood pressure drops suddenly, and that is when the patient can have cardiac complications. Suddenly you can have a heart attack, as you may have heard. That is why there is a dogma that sildenafil causes a heart attack and that it greatly reduces the pressure itself. It is not sildenafil, because by itself, if you were not taking anything else, The only thing that will lower your blood pressure is around 8 millimeters of mercury or 7, some say. Literature when you start looking. In other words, it is not something that is representative, nor does it put your life at risk. When it does put it at risk is when you combine it with these drugs that I told you about. Nitrates, which is sodium nitrate. Forget isosorbide nitrate. There are even other drugs such as riociguat or ritonavir, which is a drug used in ITSA. It is an antiretroviral used in HIV. These drugs you can never take sildenafil if you are being treated with them. Because if they are going to enhance the adverse effects. What else can patients who have had a stroke not take sildenafil? The same as a cerebral hemorrhage or a transient ischemic attack. Finally, I want to talk to you about the Nico Brandy case. This drug. We say it is a hybrid because not only do they act on potassium channels, but their composition also includes nitrates. Therefore, if you are taking this drug or Corandel, you cannot take sildenafil. And fundamentally it can cause headache, which is a headache. It can make you dizzy. That is why it is not advisable to give it when you go to drive later, because it can affect your ability to drive or whether you are working with machines. It would also not be advisable for you to take it because for the same reason, because it can affect your ability to work. It can cause blurred vision. Some patients also report alterations in color perception. It can cause bronchitis, alopecia. They report myalgia, which is like muscle pain that you feel. And this also depends a little on the type of phosphodiesterase 5 inhibitor you are using. Because currently new ones have been created that have in the end they have the same effectiveness. Regarding the final effect, however, it has been observed that the adverse reactions are a little less and are even a little more specific. For example, currently there is one called tadalafil. The advantage it has over sildenafil is that tadalafil acts for 36 hours when sildenafil is only in your body for 5 hours. This would be the biggest advantage, huh? However, as a frequent adverse reaction, it produces the presence of myalgia. There are others called avanafil or vardenafil, that is, many have been created. And the difference between them, as I told you, the difference is basically the profile of adverse reactions, because the effect in the end is going to be the same. So, to finish the program I want to tell you about the question that if I have overdosed, what should I do? Well, if you have taken it, I want to tell you first in relation to this. There are patients who have had studies who have taken 200 milligrams of sildenafil and yet it has been observed that it does not increase the effectiveness of the drug. In other words, just because you take more than 100 milligrams does not mean that you will have more of an erection and that it will be present for a longer amount of time. Not really. Studies have already been done for this. Clinical trials to evaluate this behavior, and what has been observed is that it will not improve your sexual performance, but adverse reactions will increase. The frequency with which they will appear and the intensity and severity of the adverse reactions. This has increased. That is why from here I am already recommending that you take the dose that corresponds to you, and if you have reached 100, then you will have to do a general evaluation, even psychological, to be able to evaluate other causes, not the causes. So, if you have taken it, what you should do is immediately go to your health center, go to your nearest hospital, and depending on the clinical situation you are in, it will be the treatment they give you. They will never do dialysis because since sildenafil is not practically eliminated through the urine, there is no reason for them to do dialysis. Maybe what they are going to do is put fluids into your vein to try to increase the pressure. In the event that it has dropped too much, perhaps they will use some drugs, vasoactive drugs to increase your pressure, drugs that close the vessels and increase your pressure, and general measures actually. But they're not going to do anything else to you apart from this. Well, now, I'm going to say goodbye. I really hope that the program has been very instructive for you, that you are now able to answer the most frequently asked questions that we are always asked in consultation, which is if I can take sildenafil, if I am hypertensive, if you can. In reality, if you are under 45 years old, you are a healthy patient, you will not even need to undergo a cardiological evaluation. If you are over 45 years old and have any condition, you will first have to see a cardiologist to evaluate your cardiovascular system and tell you if you are more or less at risk, and depending on the risk, the dose of sildenafil will be prescribed for you. But in general it is a fairly safe drug that can be used, but I always advise that it be prescribed by a doctor and not that you acquire it by any other means and take it. Well, now, I already have patients, So well, I'll leave you. 1,000 hugs, 8,000 kisses. Take care of yourselves and we'll see you on Monday. Bye.
Yes,